Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and take actions to try and make better systems for all of us. Today we're going to talk about the cost of healthcare, and we're going to have some legal issues to discuss regarding Mifepristone, the abortion medication. But first, let me tell you, down below in the YouTube description box will be a link to today's Healthcare Advocacy newsletter, to which you can subscribe for free and have it delivered regularly. It is the text for today's video. All of the links to the news stories and studies and references and data and actions that we'll take, they'll all be in that newsletter. Okay, so let's get started. Drug cost updates. Senator Chris Murphy, who is a Democrat from Connecticut, conducted what may have been the most rhetorically effective inquiry this week in the Senate hearings with drug makers. Responding to Bristol Meyers Squibb CEO Chris Boerner's emphasis on the importance of patient choice in the U.S. healthcare system, he noted the dire choices faced by a constituent using Bristol Myers Eliquis blood thinner. I quote, "Here's her choice," Murphy said. "Her choice is to pay the $350 and go without food, or pay her rent late, or not take the drug and risk heart attack and stroke. Is that the choice that you're talking about?" "That's a choice that no patient should have to make," Boerner replied. "We have priced Eliquis consistent with the value it brings." Did you hear what that means? That's as much as saying they can squeeze as much as possible out of sick people. Hold that thought. Let's talk briefly about the high cost of medical care. According to Capital in Maine, which is a news source, for most California residents and the vast majority of the state's lower income workers, the cost of health insurance has been running away from them for years. That's hardly news to anyone who's actually had to use their health policy in the recent past. But the healthcare squeeze is largely incremental. It's an increase in the cost of a doctor visit here, the hike in an x-ray cost there, and of course you have the yearly premium increases and the increases in copays and deductibles. Those costs almost never go down. They rise in a gradual and consistent way that many people don't pay attention to or aren't aware of just how dramatically they've escalated. Well, a new report from the University of California, Berkeley Labor Center puts those costs in context, and the result is breathtaking. In short, Californians have been absolutely hammered by insurers and providers over the last 20 years. As a result, many of the state's residents either don't use their health coverage, even though they need it, or they go into debt trying to pay for the insurance and the medical costs their plans don't cover. Specifically, consumer health care affordability has deteriorated over the past 2 decades in California due to rising premiums, along with increasingly common and increasingly large deductibles for job-based coverage. Now, taken together, these trends in premium and deductible growth result in healthcare taking up a larger and larger share of household income. This has consequences for Californians' health and financial well-being. A significant portion of California adults with any type of insurance, including those without insurance, reported that in the last 12 months, they or a family member had delayed or postponed care due to cost. That was 52% of them. They had problems paying or couldn't pay any medical bills, 27%, or some had some kind of medical debt that they were in, 36%. Look, let's take an action on this and let our representatives in Congress know where this stands. They need to know that the high cost of healthcare is a detriment to everyday life. You can use ResistBot on your cell phone by texting SIGN, S-I-G-N, space PTUCNA to 50409, and you'll be sending this email I'll read to you. Or in the resources section down in the box below, you can get their phone number and email, and you can send them an email on this. But here's the one I sent. I'm your constituent, and I want you to know what I just learned. Americans are having a hard time with medical bills. UC Berkeley just found that more than half of the adults they surveyed, with or without insurance, either delayed medical care or had a family member who did. 27% have medical bills they can't pay, and 36% are in medical debt. Meanwhile, in Senate hearings this week, Bristol Meyers Squibb CEO Boerner was happy to tell the Senate that they will charge whatever they want for drugs, effectively saying, pound sand. I've had enough. You can fix this. Universal health care, like HR 3421. It will allow us to have fair drug prices because we'll be able to negotiate with all the manufacturers for 330 million of us. It insures all of us cradle to grave, and it costs hundreds of billions of dollars a year less, according to the Nonpartisan Congressional Budget Office. I want you to co-sponsor and enact universal health care for your constituents. Thank you. Let me talk briefly about abortion court cheaters. A scientific paper that raised concerns about the safety of the abortion pill Mifepristone was retracted by its publisher this week. The study was cited 3 times by a federal judge who ruled against Mifepristone last spring. That case, which could limit access to Mifepristone throughout the country, will soon be heard in the Supreme Court. Sage, who is the publisher of the journal, retracted the study on this past Monday, along with 2 other papers, explaining in a statement that expert reviewers found that the studies demonstrate a lack of scientific rigor that invalidates or renders unreliable the author's conclusions. You can read that as fake data. Lawyers and those seeking to subjugate women created a case in Texas to make sure they got the only judge available, the only federal judge available. His name is Kaczmarek, who, by the way, admits to being biased in this case as an anti-abortion activist. Excuse me. These lawyers and these plaintiffs latched on to these false studies because it met their preconceived conclusions. Since the evidence was false, can the case be overturned? And I include a link to the full news story there. Here's an action. This is an extra credit action, and I did this one already. Here's the court number, the phone number for the U.S. Supreme Court clerk. I'm going to read it to you, but I will put it in the description box. 202-479-3011. If you dial that, press 3 to leave a message for the clerk. The case number is Petition Application 249A-254A. We can call them and let them know that the studies that were so key to the ruling against Mifepristone and were referenced 3 times by Judge Kaczmarek have been retracted by the publisher, Sage, after expert reviewers found that the studies demonstrated a lack of scientific rigor that invalidates or renders unreliable the author's conclusions. So how about reversing that ruling based on false data? That's what I told him. Okay, let me talk briefly about prior authorization. The federal government has new rules for prior authorization. Earlier this week, I mentioned that the Biden administration had issued a new rule regarding prior authorizations for many but not all policies. It is CMS Advancing Interoperability and Improving Prior Authorization Process, Rule CMS 0057-F. It is in place. I thought they were going to have a comment period later this week. Comment period is over. The rule is in place. And what it does is in urgent cases, insurance companies must respond within 72 hours on a prior authorization request. They also have to keep track of data on denials and make that publicly available. This will only cover about 105 million people. It covers ACA plans, Medicare, and Medicaid only. It does nothing for the 158 million of us who rely on insurance from our employers. Okay, that's what I've got for you today. Down below, you can like, share, subscribe. You can subscribe to the Healthcare Advocacy daily free newsletter. Get the stuff delivered to your inbox all the time. You can leave me a comment, leave me a request for research, or you can send it to healthcareadvocacy1@gmail.com. That's it. Have a good evening.